Hi everyone, welcome back to iMumz Ask Me Anything session. So today we are back with a very important topic, something that is discussed, and I've seen in the groups also that you're always constantly talking about a sigh of relief when baby poops after a few days, and you are always worried if it is okay, if it is not. So we thought, why not have a discussion on what is normal and what is not. So today we have Dr. Ajay Gupta. Many of you already know him because he's been with us in previous session. He's the one who is reverting to your queries and clearing all your small doubts. So he is a senior pediatrician from Batinda, and right now he is trying to, reach out to as many women as possible and try to help them selflessly, right? So I think during these tough times, he's doing his bit to help all the new mommies. And we are very, very happy to have you with us, sir, and all over to you.
Thank you so much, Ansuya. It's always great to be with you and at iMom's platform. Actually, helping or not helping won't matter, but the thing is that at the point of at mom's end, it is always a sigh of relief when they get small answers to their daily queries. So I'm always there for you. So today's topic is all about pee and poo, and I will be talking pee as urination or urine or poo as stools. So, because as a doctor, it will be very difficult for me to always speak those words, which you might be using very commonly these days. So, the purpose of today's this CME or presentation or talk is that we need to know, we need to take away what is right and what is wrong. And maybe some things are natural, they might prove to be right, and they are not going right in your minds. So, when to call a pediatrician, that should be the aim of this session today. So let us start with the normals and abnormals of the stools, stool frequencies, stool colors, stool consistency, and stool smells. To start with, I would just start that at the time of the birth, baby has to pass stools within 24 hours of life, and he has to pass urine within 48 hours of life. So this is a mandatory sort of condition from a doctor's point of view, which he is always looking for. If a baby doesn't pass stool within 24 hours, that rings an alarm sort of bells into the minds of the doctors. They need to investigate and find out the reason what is going on. And if the baby doesn't pass urine within 48 hours of life, again, the alarm bell rings in the minds of the doctors. What is wrong? What is wrong in the urinary tract, and what is wrong in the system? So when the baby passes the first stool, sometimes say it is 20 hours, 24 hours, nearing 24 hours, and all of around the baby, mothers, parents, doctors, all of them are a bit, worried and conscious about the fact that stool has not been passed. What happens is in the delivery room, in the operation theater, when the baby delivers, the baby passes the stool at that point of time, and that is always noted by the pediatrician in your file or your records, but that's not known to the parents sometimes, and that creates a sort of worry when they present this thing to the doctor and they find out the, obstetrician tries to find out in the records or tries to check with the pediatrician. He says, yes, I noted down, and the baby passed stool or baby passed urine at that point of time, and that's recorded. So that needs to be checked first of all before creating a sort of worry in your minds, I would say. So then I would say the frequency. Let us talk about the frequency itself, because we have started with the first urine or the stool. For first of all, for the stool, the frequency initially will be like the baby will not pass much of the stools in the first, say, 2 to 3 days. The frequency might be less because baby is actually not latching on, not taking breastfeeds to that normal frequency which a baby gets on at the third day onwards. So जब भी बच्चा दूध पीना शुरू करता है, that is usually the third day onwards. जब when the baby starts feeding well, third day onwards, then the stools also increase in the frequency. So the frequency initially for 2 3 days might be less. Say it can be just 2 to 3 times, and then beyond 3 days to 10 days, it can be just 3 4 times. And beyond 10 days, when the baby is quite adapt to the environment and taking breastfeeds well, or maybe you have put the baby on the formula, then the baby starts passing stools to the frequency of 5 to 10 times in a day. And in a day means in 24 hours. So that increase in frequency sometimes worries the mother. So what is happening? Because we always compare everything about stool and urination of the baby with ourselves as an adults. So passing a stool 5 to 10 times for a breastfeeding baby, it's absolutely normal. And sometimes parents say, whenever I have seen in my OPDs that the baby is passing stools to the tune of 15, 16 times, 20 times even. For that, I need to check as a doctor. I need to check whether uh, what happens is when the baby passes stool, and the nappy gets wet, baby's brain gets the signal that something wrong is going on there. When the stool touches or the urine touches the buttocks or their perineal area, and that there is a signal to stop for some time. And by the time if mother realizes that the baby has passed the stool, she just wipes out and cleans the baby and just changes the nappy. And the moment she changes the nappy, there is another gush of stool coming behind. So she counts it as stool number two. So what I said, the normal frequency is say 7 to 10 times. That becomes 15 to 20 times. So as a doctor, I would always consider these two stools as one stool actually. So the frequency then again stays to be normal, say approximately 7 to 10 times. A breastfeeding baby or a formula feeding fed baby will be passing 5 to 10 stools in 24 hours. That is absolutely normal. And this continues till the age of approximately 8 weeks, 2 months, I would say. So say 10 days plus minus, baby starts decreasing the frequency of the stools. And at this point of time, in another say 2 weeks, baby might pass only one stool in a week, in a day, or maybe one stool in 2 days, or maybe just one stool in 3 or 4 days. So again, doctors looking at the other conditions will determine whether this stool is normal or not normal. But as a thumb rule, even one stool till the age of 3 days in a breastfed babies or one stool in say 5 days in a formula fed babies would be absolutely taken as normal. So beyond that, the another change in frequency might come at the age of 6 months. Why 6 months? Because at 6 months, again, we will be introducing solids. We say weaning. We start the weaning of the baby. So at that point of time, again, the frequency might get a bit disturbed or might get altered, I would rather say, which can create a sort of concern in your minds. Again, that is normal depending upon what food you have started, what are the ingredients, what is the frequency that you are offering, and what is the amount of the food that you are offering. So this is regarding the frequency. We can just discuss more questions from you at the end of the session. Now I will come to the next to the color, and I would definitely say the color of the stool actually is is the concern of the mother for the maximum time periods. So, to start with, I said at the time of the birth, when baby passes stool, that is usually dark colored, dark blackish, greenish blackish colored of stools for the first 24 to 36 hours. This is called meconium. So this stool, while we are breastfeeding, we are offering feeds to the baby. That this feed starts, this black color starts changing to yellowish color subsequently on day two onwards, and becomes a normal, say mustard yellow or light yellow color, depending what feeds we are offering. So baby passing blackish or greenish black stools within 24 to 36 hours will be considered absolutely normal, and it is called meconium. Thereafter, baby will be shifting gradually to mustard yellow colored in the breastfed babies and light yellow in the, formula fed babies, and that would again be considered as normal. And subsequently, orangish color stools can be there, which can be because of formula feeds being given to the baby. That is again considered to be normal. So next we can think of is say dark greenish colored or light greenish colored or just a greenish tinge into the yellowish stools, which is the maximum state of worry for the mother. Again, I would say that is absolutely normal. Uh, Again, we do not have to compare the color of these stools with adults. In adults, what might be wrong, it is actually normal for a baby. So greenish colored stools, that is normal. And at the age of 2 months onwards, when pediatricians they add iron uh, to the diet, say to iron supplements to the baby. At that point of time, babies might also be passing dark greenish colored stools or darkish blackish colored stools. That is because of the staining of the stools because of the iron. Again, that is normal. So next color can be, say, white colored stools. We call it in doctor's language clay colored stools. Now this clay colored stool, that is a problem. That can be because of some liver disease. So that rings an alarm bell. If you see that your baby is passing clay colored or whitish colored stools consistently for 2 3 days, then you should consult your pediatrician. And again, red colored stools, that again is a area of concern in a baby less than 6 months of old, 6 months of age. So reddish colored stools, if say baby is passing hard constipated sort of stools and there is a streak of redness alongside the stool, that indicates some sort of injury or fissure in the baby, which is causing that streak of red color. Or maybe red color can be dissolved in the stool, fresh red colored, bright red color, that again indicates some sort of problem in the baby. Again, this color can be maroonish yellow, a maroonish red color. This again is a area of concern where you should consult your pediatrician immediately. So primarily, these are the colors which indicate one or the other problem in the baby. So we need to just consult the pediatrician as and when we see that these colors in the say the alarm zone they come, like red color, brownish red color, clay colored stools. These should be consulted with doctor immediately. So the next is the consistency of the stools. Consistency of these stools can be normally, as you say, the first 2 3 days. This can be just tarry black colored stools which are quite sticky. That is the meconium or meconium turning into the mustard yellow normal stool. That can be a bit more sticky as compared to the subsequent stools. Then a breastfed baby that can have a sort of watery stools with a bit of seeds in it. That is again a normal sort of stool. And this breastfed pattern is like you give the feed to the baby and baby immediately passes the stool. And if you give, say, feed eight times, then the baby will pass 8 times stool. And this again should be considered very, very much normal. If we see that in case of formula fed babies, this frequency is a bit lower as compared to the breastfed babies. And formula fed babies might be having a bit light brownish and a bit, say, formed consistency, not a loose consistency uh, as compared to the breastfed babies. So again, no concern about, I mean, the breastfed babies or the formula fed babies. They might be passing, or maybe you are giving formula fed formula also and breastfeed also. Then the stool consistency can be just variable from loose to slightly formed stool. That is absolutely normal. And sometimes it happens is that stool is very, very hard and it is very difficult to pass, and it is like pellets and small granules. That can be normal, that can be abnormal. Normal in the case when sometimes you find that the baby is not accepting feeds to that frequency or quantity, then sometimes baby start passing some what hard stools, but it is automatically corrected when you start giving a better amount of feed, and baby is sometimes just not taking adequate feeds. It is baby is passing harder stools, and when the baby is accepting good amount of milk, then he might shift to the normal stools. So this is pertaining to the consistency. The one point I would like to highlight is sometimes babies strain too much, but the frequency is also normal, consistency is also normal. So just consider this as normal because babies are in a habit of passing such stools, I mean, such noises, groaning sort of noises before passing the stools. That is absolutely normal. So next is smell. So in the earlier, say, the initial part of the initial phase of the baby, say first 2 days when the baby is not taking adequate breastfeeds, or when the baby is passing meconium, then at that point of time there is absolutely no smell in the stools. Rather, you will not find any odor in it. When baby starts taking breastfeeds, subsequently the baby stools, they get a small a bit of odor, which is not, I would say, pungent or foul smelling. But formula fed babies, their stools will smell very, very pungent some point of time, and we do not have any answers to that. If you are giving formula feeds to the baby, then this odor has to be there, and you have to just stay with it. But sometimes when the baby is passing stools beyond, I would say, 6 months of age, when you are giving solids also to the baby, and that point of time, sometimes the digestive system is not so uh, adequately functioning. At that point of time, nutrients, they stay inside the stool and they are passed as such. You can see the food particles as such passing down the stools, and they stay like this for 1 or 2 days, and then the stools become normal. So you should not get worried on day one of when you see that the baby is passing some food particles into this. But if this problem stays beyond, say, 2 days, then you should consult your doctor. And these stools are sometimes foul to smell also. And next is that when baby is having some GI infection, say gastrointestinal or tummy infection in the layman's language, I would say, those stools have bacterial colonization. I mean, they get some infections into the gut. Then these stools become quite foul smelling, and that becomes a sort of indication. But there is a definite difference between a pungent smell and a foul smell. You need to make out so that you should know when to raise an alarm and meet your pediatrician. So this is color, consistency, and frequency and smell about the stools. And now I will just briefly tell about the urination patterns. I started with day one when I said that within 48 hours, baby has to pass urine. Again, subsequently, baby normally passes urine to the tune of, say, 7 to 10 times, 6 to 10 times, I would say, and that absolutely depends upon how much feed baby is accepting and how frequently the baby is accepting breastfeeds or formula feeds, whatever. So, if the frequency is lesser than 6 times in 24 hours, and the urine color is yellow or dark yellow, this means your baby might be dehydrated. At this point of time, you need to just, see whether the frequency during the last few hours, frequency or amount of feed that you are giving to the baby might be lesser. And if you step up or boost up the amount of the milk given to the baby, then the frequency will again be maintained and it will shoot up to 6, 7 times in next 24 hours. Or maybe the baby will immediately pass 2, 3 more times when the baby is taking feeds, and the count becomes more than 7 times in 24 hours, and you need not worry for that. Okay. I think I am done with the briefing of the topic. We can take up questions now, Ansuya.
Thank you so much, sir. I think you've answered most of their queries already, but I'm just going to ask you. You might have some repetitions. I'm sorry in advance.
Okay.
Yeah.
Actually,
So Deeply is saying my baby is 3 months old on exclusive breastfeeding. He passes stool once a week. How to make it regular? So now Swati also has the same question. She says my baby is 10 weeks, and from the last 2 weeks, she's passing stool in 3-4 days. And today this week it's been 5 days. How to make this regular? She's active and taking feeds regularly.
so first of all, I would like to ask you what is regular. So regular, I told you, is if the baby might pass stool once in say 5 days on a formula feed. That is absolutely normal. You need not try to make it regular. It is absolutely normal. You rather you should not feel worried about it. Things are normal. As a pediatrician, I would always say um, you should be relieved that you don't have to do this job time and again in a day. It is normal. And again, I would repeat a baby on breastfeeds if does not pass stools for 3 days and it's on fourth day, and a formula feeding baby say does not pass stools for 5 days, then you should consult your doctor. He might look into some reasons to this decreased frequency. Otherwise, these are considered normal.
Thank you, sir. So Radhika is asking, my baby is 2.5 months old and breastfeeding at times. He does poop with watery consistency with CD pattern, and at times it is buttery texture. So why
Hmm.
does it keep changing? Is there anything that I need to change in what I eat and drink? Please guide.
Okay, there is another taboo that mother's diet affects the stool of the baby. Though it is true to some extent, but that is not absolutely true. Sometimes, when the mother is taking nuts and say a lot of fats, sometimes that changes the pattern of the stool in the babies. That the babies might be passing a bit bulkier sort of stools. Otherwise, that doesn't affect the baby. So you do not need to do anything to make the things right. You just take your nutritious and balanced diet, things at your end, passing that watery stool with some amount of seedling. I earlier also said that on a breastfed baby, on a breastfed baby will be passing these sort of stools, and that is absolutely normal. So you need not worry about that.
Thank you so much, sir. So, Isha is saying, how much milk should a 3-month baby have? I give her pumped breast milk and formula. She passes stools every alternate day. Is it normal?
Yeah, it's absolutely normal. Regarding the quantity of the milk that a baby should be taking at this point of time, that is never determined from a doctor's point of view. We always say that the baby has to be on demand feeds. Baby will be taking the feed. Suppose you are giving a set amount of expressed breast milk to the baby, and that is say it is 150 ml, and you find that the baby gets hungry within say 1.5 hours or 2 hours, then you will realize that the baby got hungry, and the volume might be lesser. So you need to increase that volume. But again, if you increase the volume, baby might not accept that, and baby will be just taking 150 or 140 ml out of that and leave, or start closing the mouth or refusing the feed at that point of time. So again, it is the demand of the baby which will decide how much milk the baby is going to take. And for you to determine whether you are giving adequate volume of milk, just check that if the growth chart is giving you a rising weight pattern and the baby is in on the road to health point, say the baby is gaining adequate weight as required, then you should not be worried that you are giving lesser milk or more milk, both cases.
Thank you, sir. Sir, Shivani is a mother of a 5-month-old baby, and baby is exclusively breastfed. So she's saying my baby did not poop in last 7 days. Last she did was on 20th, and now I'm waiting. She usually does it between 5 to 7 days. So yesterday she gave her formula after 20 days. So I have also seen a lot of panic. Like I'm trying cycling exercises, I'm doing this. Finally, they poop. So how worried should we be? And if baby is actually suffering during that time, I think that's the main question.
I know. At this point of time, as a pediatrician, what I will look into is I will just have a feel of the tummy, and if the tummy is soft and not showing any sort of firmness at any point of the tummy, and the baby is not vomiting, baby is quite playful, and I would just consider that the things are normal from a general examination perspective. But again, if this is happening, say time and again, and you yourself have realized that 5 to 7 days is the time period that my baby is taking for the stools to pass, and the baby is on formula feeds also, with along with the breast milk also. Again, that should be considered in a normal sort of window. But again, I said beyond 5 days, formula fed babies, if they do not pass stool, you should once check with your pediatrician. But again, if there are no signs, you can stay a bit. You can stay satisfied and calm, because in these times when you will not be finding very easy to find doctors, and you personally won't be liking to go out to see a doctor in hospitals. So consider it normal. Don't worry. Don't wait for these tools to come. Let the things go.
Yes. Okay, thank you, sir. Sir, Deepthi is saying if we put baby in the AC room, then will the peak count increase? Can we put a 3-month-old baby in AC room?
Yes, you can put your baby in an AC, because as an adults we feel hot or cold. Similarly, babies also feel hot or cold, and they also need a very comfortable environment to stay cool and warm. So what I would suggest is you can keep your air conditioners on, and try that the blast of the air is not directly towards the baby. And while you are just switching on your fan, that should not be creating a lot of air currents that a very fast speed fan would be doing. So you can just switch off the fan and switch on the AC and keep the louvers up, so that the blast of air doesn't be directly is not going directly onto the baby. And regarding the number of the urine frequencies, I would say number of P's that I would consider as a you see that during summers the frequency of the passing the urine that decreases a bit, because body starts losing water through the skin in summers, and body starts regaining water during winter. So you have already seen during the winters that the baby passes urine uh, a bit higher times, more times as compared to summers. In summers, it decreases from normal, and in winters, it increases from normal. That is a usual thing. So, if you are putting a baby in AC and the room temperatures are, say, quite low, say 20 degrees and less, then your baby might pass additional 2 to 3 times of urine, and that is absolutely normal.
Thank you, sir. So Ashwini has a query for you. She says, "Hello, doctor. My baby is 6 months plus. I started solids and he's on formula milk, breast milk, fruit purees, fruit juices, rice water, etc. He poops almost every day, but the stools are very hard. Is it normal? Because this was not the condition before starting solids."
Mhm. I told you when at 6 months of age you are adding say solids, or you are weaning the baby. At that point of time, there are a few changes that happen. As you are giving all the advised things like fruit purees and breastfeeds, formula feeds. There is a lot of say different things going on now, and the system GI system of the baby has to learn how to behave and how to adjust the different type of foods that the gut is receiving now. So the pattern sometimes changes at this point of time, and to have a bit of harder stools which are not difficult to pass, or maybe you are considering harder because baby is training a lot, that is absolutely normal. Again, I would say that if this tool is too hard to pass, and you see that pellet-like or small bullet-like pellets are there in this tool, then you definitely should consider a pediatrician. He will look into the things and decide a few investigations to get it done. But if it is just a changing pattern, then you can wait for a bit of time, say for 1 week or 2 more weeks.
Thank you, sir. So one common question I keep receiving is, baby is constipated. So, is there anything they can try at home in that case, or should they directly rush to the pediatrician? Like, is there any home remedies that you would suggest before they go to the doctor?
Mhm. Okay, so then what is constipation? So first understand that the constipation is continuously, passage of hard pellets, stools, and which is causing a lot of trouble, I would say, to the baby. And this is happening continuously for a week or so. So, in such patients or such babies, I would consider that first of all, you need to see if the baby is adequately hydrated and the baby is accepting normal frequency, normal volume of milk and other foods if he is 6 months or older. So if everything is normal, then feeding is normal, urination is normal, and baby still does like this, and you sometimes get worried what to do at that point of time. You can just apply a bit of coconut oil, say with your nails of the little finger cut, and you can just put say 1.5 centimeters into it or 1 centimeter into it and just rotate your finger to lubricate, I would say, just the part of the anus. Sometimes in the lower end, when the stools we call feculae, they get dried up, stools get dried up, they just cause a sort of obstruction for the stools that are higher up, which are absolutely normal. And some babies have this tendency. You just lubricate the anus and you find that the stools are very normally coming down. And when you just examine the stool, there is a small hard palate in the initial part of the stool, and beyond that, the stool is absolutely normal. So that is a normal sort of situation that you can handle at your home only. I would not recommend any other remedies that your grand moms would be suggesting, because I have seen babies landing up with some other problems when they are taking homemade remedies, especially to tackle the constipation in a baby. And one more thing, mothers are sometimes using small suppositories to handle this, and which they get from the chemists and the pharmacies near the houses or homes. So that is absolutely not recommended. You should rather consult a doctor to alleviate your worries instead of giving such suppositories or laxatives to the baby, because there are other implications of using these sort of drugs in a baby. You should never use these sort of things.
Thank you, sir. So
Another,
Smita is
yeah,
yes.
one more thing that I could suggest here is what you can do is, while you are just seeing that the baby is not has not been taking adequate milk, you can step up. That is a normal thing. But if in case of 6 months and older babies, when you can give solids to the baby, what you can do is you can add a bit of good or shakkar in the diet, in milk or whatever you are giving as solids. Some sweet things you want to add shakkar or gur into that instead of white sugar. That is highly recommended. And you should use desi ghee in the babies as the oil substitute, rather than giving refined oils or some other oils, some fancy and other cold pressed and some other oils. So this will actually make these are the very natural things that can help you avoid constipation. And whenever there is constipation, if you immediately say shift, I have many use cases or many patients where I added good shakkar instead of sugar, white sugar, and shifted on to the desi ghee in diet. Babies are absolutely normal. Who the mothers were worried about having constipation, they are leading a normal life, and the babies are absolutely normal. So consider good shakkar and desi ghee in the feeds.
Thank you very much, sir. So, moving on to the next question here. Smita is saying my baby is 6 months old and his weight is 7 kgs. Which solid food should I give to increase the weight?
To increase the weight. So weight is absolutely normal. You want to increase, by leaps and bounds, then you can add lots of desi ghee and lots of sugars to that. But otherwise, just be natural. 6, 7 months onwards, all those feeds that are recommended are starting from cereals like dal, chawal, khichdi, dalia, curd mixed with banana. pears and purees, of fruit purees, I would rather say. And you can add on to, say, सूजी का halwa. Later on, you can make it atte ka halwa. Uh, that are the normal things that we in Indian homes we cook naturally and normally, and that is what we. I always recommend to the mothers that you should make the baby eat from the family pot. By saying so, I want to say that whatever you are cooking in your homes, the foods offered to the babies should be similar to that, so that you don't have to cook two different of foods, two types of foods in your kitchens, one specially for the babies and one specially for you when the babies are say 1 year or older. So make the habit initially, I mean, at the start of the weaning, 6 months, 7 months onwards, that the foods are very much home based. Use ready-made foods only in the case when while you are traveling or when you are just visiting some friend's place or somebody somewhere where you can not cook your own food.
Thank you so much, sir. So, next query is from Sheetal. She's saying, my baby is 5 months old and spitting lots of milk since morning. What could be the reason and what can I do to stop it? Since the last 2 days, I have started giving him iron drops. Can this be the reason?
Yes, that absolutely can be the reason. In a few babies, we see that when we start iron drops, these babies spit or may be vomit to some extent. So what you can do is, first of all, at your house, at your own end, you can just mix these iron drops into some, say, fruit juice or some sort of food that you are actually giving, except milk, so that sometimes the problem is solved. And if this continues to happen, then you should consult your doctor and just report the things to him. He might look into the matter and find out that if the iron is responsible for that, then he will change the salt of that iron. Sometimes a few, I mean, one or two salts they cause vomiting or indigestion or some other problems, and he would shift the salt which is not suitable to the baby to a suitable one.
Thank you, sir. So, moving on to the next question. Saubhagya is saying, do we need to give cow ghee only or can we give buffalo ghee? And what is the shakkar that you are recommending instead of sugar? She is from South India, so I think shakkar she would
Okay.
not have understood. And can we add dry dates powder instead of sugar?
Okay, dried dates will serve the purpose, I think, because in Punjab and northern regions we are using this good and shakkar, which is prepared from sugar cane, and in south probably coconut is the main thing from which you are preparing your oils, and dates you are using instead of good. Then you can make the powder of the dates and use as a sugar base. That is absolutely normal, and that is again a very natural sort of thing to digest, and absolutely better than white sugar. And you said whether you should use cow's milk ghee or buffalo's. Both are absolutely normal. Cow's milk is usually not recommended by doctors in the first year of life. They say that the cow's milk, if at all has to be given, should be given after 1 year of age. Maybe I am missing one part of the question. What is it? Can you let me know?
No, you've covered everything. She just wanted to know if buffalo ghee is okay
It is okay. Buffalo
while
ghee is
cooking.
okay, and cow's milk ghee is also okay. Yes. So there is.
Absolutely.
I would like to add here, while we were talking that cow's ghee, cow's milk usually should be avoided in the first year of life. Why? Because this cow's milk can cause milk protein allergies. Cow's milk can cause a bit of bloody stools, which is sometimes invisible. We call it occult blood, and baby keeps on losing small amount of blood in the stools without knowing, without we as parents knowing, and that causes anemia, decreased blood levels, and this can cause as such frank red colored or blood stained stools also, because of the allergy also, or because as such because of the cow's milk also. So we usually do not recommend this cow's milk in the first year of life. because of these reasons. So if at all you are using, shift to other form of milk.
Thank you, sir. So, I'm checking Swati's question here. Swati says, my baby has started taking solids from last week. He used to poop once a day in 5 days, but since 2 days, he's pooping daily, uh, but green today and darker and thicker green. He was also crying a lot while pooping. What can I do to relieve him?
Okay, probably you have just started with the weaning, and there is a transient phase when the stools will also change. When the baby's GI tract is accepting other foods in addition to, say, milk. At this point of time, you will have to wait for a while, say, for another 1 or 2 weeks to get the things all right of its own. And but if it is happening for the last, say, more than 5 6 days, and you are finding the things difficult, then see that what sort of foods you are giving, and just stop those things and shift over to something new, and probably things will get all right of their own. And then you can just mark these foods that have caused a bit of constipation, and retry these articles, say after 1 month or so, to find out whether this was the absolute reason for constipation, or that was a transient state of affairs. Again, you can add, say, if the baby is passing stools with difficulty, and baby is crying at that point of time, just have a look at the lower part of the anus, whether there is some sort of injury there. Sometimes there is a small fissure or some sort of injury there which is causing the trouble, and you can apply coconut oil in the minor form of the problem, and it gets rectified of its own.
Thank you, sir. Sir, I think this is a repetitive question. Seema is saying, my baby is 5 months old. He passes stool every 2 days and sometimes 4 days. He's on breast milk, and at night he takes formula milk once. Is this a matter of concern?
No, absolutely not. It is a normal pattern.
Thank you. Thank you, sir. Radhika is asking another question here. Can mothers also take ghee and jaggery so that baby does not get constipated while breastfeeding?
uh, Mothers can, rather, mothers should also follow the same path that we are advising for the baby, because that's an absolute reason for being a better sort of option in place of white sugar. So you can take good sugar instead of white sugar. That is good for health also, and that's good for your baby's health also. And ghee again you can take, but in the permissible levels. You might not blame me for having lots of ghee to have good health of your baby, and you put on another 2 3 kgs of weight by the time I come next to the session. And another thing that I would like to say is, your eating these things will not directly affect the, say, the baby's stool or urine patterns. You're eating these things, ghee and good sugar, would definitely be helping babies to have good nutritive feeds, I would say. It doesn't make a difference in how the baby is passing urine or stool, but it definitely makes adds to the nutritive value of the breast milk.
Thank you, sir. So the next question here is by Namrata. She would have joined late. She says, my baby is 28 days old and she's pooping more than 2 times. Is this okay? I think sir has already mentioned that it is okay, right?
It is absolutely normal for baby to pass, say, 5 to 10 stools. I explained earlier, in 24 hours, and that is absolutely normal. So you should not get worried. Again, I would say the next steps that would be coming, say, beyond 8 to 10 weeks, your baby will be passing lesser number of stools. Again, that might be once in a day, or once in 2 days, or maybe once in 5 days if the baby is formula fed. So again, there is nothing to worry, because you have just joined the session. So it is specially for you.
Mhm. Thank you, sir. Sir, a little out of topic. Sheetal is asking, my elder child is 5 years old and I want to know if I can delay 5 years vaccination or not. due to the pandemic. Can I delay it for 3 months?
Definitely, you can do. At 5 years of age, we usually are giving boosters to what we have already given at the age of, say, 1.5 years of age. So, booster effects are needed at 5 years and beyond. Delaying it in these special circumstances would not harm the child. You can postpone it to 2 to 3 months. When the things get all right, you can get these booster doses.
Thank you, sir. So Anishri would have joined late. I think this will be a recap for everybody who has joined late. And looks like this is the last query we have. If you have any other query, please quickly put in so that we'll take it up. But for
So,
now, what are
I would suggest that because there are a few more queries otherwise going on in the minds of the mothers, if we are just staying for another 15 minutes, they can pick up all the queries that they have in addition to their urine and stool patterns. We can just quickly answer them so that they can have a good night's sleep tonight.
absolutely? Thank you, sir. So Anushri is saying, what is the ideal pee and poop count for babies both below 6 months and above? Does pee count go down as babies grow? Is her question.
Absolutely, yes. I've just explained the patterns till the age of 6 months and beyond, 6 months till the age of 1 year, while the baby is just having a transition, while we are weaning and while we are adding solid foods. So, absolutely, at the age of 1 year and beyond, the babies will be coming to the quite a close natural pattern that the adults would be having. So again, starting, let's recap. I would rather say that initial period of say 8 to 10 weeks, babies on breastfeeds or formula feeds will be passing say 5 to 10 stools in 24 hours, and at 10 weeks, 8 to 10 weeks and beyond, they might be passing stools once in a day to say once in 5 days even. And at 6 months, while we are adding solids to the diet, again, some transition patterns must be having. Some children, some babies might be having a bit of constipation, or some babies might be straining a bit to pass the stools, and some babies will be having bulkier stools as compared to the earlier stools, which were quite, say, light and rather looser on the lighter end. And they, at that point of time, color of the stools might also be changing to a bit brownish, which was initially never the case less than 6 months of age. When we are now adding solids, the change will be from say mustard yellow to the a bit of brownish color pattern and a bit bulkier stools, and that is absolutely normal.
Thank you
So
so much, sir.
uh,
Please continue.
So one again, while we are just recapitulating again, stools lesser than 3 days. I mean, if the baby is not passing stools 3 days and beyond in breastfed babies, and not passing stools 5 days and beyond in the formula fed babies, that should create a sort of alarm and just make you aware that now I have to watch and meet my doctor if required. And again, stool color, if it is a red or a streak of redness or brownish red mixed mucous stools, in that case, or whitish stools, clay colored stools, in both these cases, you have to just raise an alarm and call your doctor. Again, mucus that we forgot to,
Yes, yes.
discuss.
I was just getting to that. Sometimes we've received complaints about foamy kind of
Yes,
a
yes,
slimy kind of stool.
yes. Absolutely, yes. And that is a very important point that we forgot. Mucoid and frothy stools are also one type of stools that we forgot to entertain in our discussion. Frothy and mucoid stools are normal, considered normal when the baby is drooling. Say baby is into teething and baby is passing so much of I mean drooling a lot, जिसको हिंदी में हम कहते हैं बहुत सारी लारें सी फेंक रहा है बच्चा. So what happens is that baby is just swelling that drool into the tummy, and that drool becomes is passed on as mucus and froth, and that is very very much normal. But again, if this mucus is associated with say a few more signs and symptoms, like the baby's tongue looks dry and baby is a bit listless, baby is not happy, baby is not feeding normal, and the baby is passing lesser amount of urine, and the most important is baby is passing loose mucoid stools, a bit of tinge of say blood also into it. that is considered as an infected stool, and you must consult your doctor at that point of time. Otherwise, in a normally drooling baby with all these factors absent, it should be considered normal.
Thank you, sir. So, Preeti is asking how to relieve gas in a month-old baby.
So, what is gas? I would first of all ask you, what is gas? A gassy baby. I mean, this is a very frequent sort of question. Everybody says my baby is producing a lot of gas. So, babies cannot produce gas. They are not taking at the age of 1 month or 3 months or less than 6 months. They are not taking anything. Say fruits and vegetables and pulses are the diets which create a sort of gas in our tummies and GI tracts, but babies are not on that. So, though milk also creates a bit of gas, but that is not so much that the baby will be gassy or, will be disturbed in a normal routine, I would say. So, what is gas? Gas is 80% swallowed air. I repeat, gas is 80% of swallowed air. While we are feeding our babies, what happens is we are just putting on the baby to our breast or maybe to the bottle nipple. And on the breast, baby is not latching and just not latching properly, or baby is taking feeds very fast, or baby is just taking feeds on the breast with one part of the areola exposed, from where air is also gushing in while the baby is sucking vigorously. Or when we are just feeding the baby through a bottle, and the bottle nipple as such has a quality, I would rather say, to push in the gas from outside, because the principle of bottle is the amount of milk that enters into the baby's mouth that has to be replaced with a bit of gas, with air, and bit of gas leaks into the nipple and into the mouth of the baby every time the baby is taking feed from the bottle. So in these circumstances, baby is actually swallowing air, and that becomes a gassy affair in the baby. So what you can do is, while you are giving, first is give breastfeeds. So feeding babies will be having more of the gas. Breastfeeding babies, we can just control and manage the posture of the mother, posture of the baby onto the breast. And while we would say that the mouth of the baby should be touching the areola all around, not open from one end so that the air gushes. So make in proper position onto the breast. And the last thing is, suppose you are when you feed, immediately thereafter you should burp. So the air which is just in the upper GI tract, say, not swallowed deep, that will be released with burping only. And I explained in the say last session also, you can just put the baby prone on your thigh with the tummy on the thigh, legs also hanging and arms also hanging. Just support the neck and tap the baby very light hand on the back of the baby, so that the baby gets a sort of stimulus and a bit of pressure on the tummy through the thigh, so that the extra air swallowed should just pass through, pass down, or maybe just burped out. So that will relieve the say deeply swallowed air, and the gas CBB will be far better as compared to not doing these processes. And it is mandatory that you, while you are doing this, I called it prone positioning on the thigh. This you should do approximately, say, 20 minutes every time. Say 20 minutes 3 times in a day, not less than that. For doing this for 5 minutes or so will not help you. And if you are doing these things, three things, when one is properly positioning the breast, then burping, and then putting the baby prone, these three processes, by my experience, I have seen all these babies are far less, on medications like enzymes and Colicate, Neopeptine, and many other sort of drugs. And you need not give other, say, food ingredients like Trifla and some Jafal and many other remedies that will be just listening from your grandmoms or moms in your house. So you will be avoiding all those hassles.
Mhm. Thank you, sir. So I think the last query of the day, Seema is asking, me and my baby just recovered from COVID-19. Today is the 25th day.
Mm-hmm.
Baby is recovered, having proper feed and everything, but one thing we are observing is that he's become more drowsy when he is awake. Is this concerning? Is this something to worry about?
Actually, very frankly speaking, we as doctors also are not very, I mean, acclimatized and learned on this COVID infections in humans as such. So what we are doing is we are just learning by experience because this has been the first instance. But your question is quite valid. As such, babies or infants who have had COVID infections, they feel a bit different. Maybe they lose a bit of appetite. They lose track on gaining weight also for some time, say 2 months or so, and they feel a bit uninterested and listless during, say, recovery phase. So, though it can be quite a normal sort of phase post recovering the COVID, but still, I would suggest you should physically get your baby checked up by some doctor so that he can just rule out something which might concern you later on.
Thank you, sir. Sir, last query, I promise. So, Swati is saying my baby's feet are usually cold compared to the body, and his head is warmer. Is this normal, or should I put him on socks all the time?
Okay. So there is a concept of बच्चे को ठंड तो नहीं लग रही या बच्चा whether baby is feeling normal with respect to environmental temperature. So there is a very rough test that I always recommend mothers to do. If you touch your baby's feet and they are quite cold, I would say not uh, just cold. If they are quite cold, and then you touch the tummy of the baby, that is warm, and then you touch the head of the baby, that is warm, this is normal. But again, you need to recheck after some time whether the baby's feet or soles are getting colder. So now the second instance, if the baby's soles and feet are cold and you touch the tummy of the baby, that is also a bit cold, not warm, I would say, not warm. So then you consider that the baby is feeling cold and you need to immediately wrap up or put on the socks or whatever, make him putting off the AC or whatever is the situation. So you're getting your head cold means the baby is extremely cold. Probably baby is into real trouble. So I'm not telling you this to make you say worried, but what you can do is in these summers, while the air conditioned is on and the temperatures might be sometimes 18 degrees or 20 degrees, as adults we always love to have, your baby's feet or soles might feel a bit cold. So it would be a good idea just to cover the baby, say till the knees or the thighs of the baby. So the extremities usually get colder faster and easily. So that will keep the baby warm as such. But if you find after covering or wrapping up the baby to the knees or the lower part, again the feet are cold, then you need to switch off the AC or just manage the room temperature as required. So I think I could answer your question. So you're muted.
Okay. Yeah, I'm
Yeah.
so sorry. So you've answered all their queries, and they are thanking you on the chat that you've made it a point to even answer the smallest query. I think that means so much to a worried mother. Thank you so much, sir, for doing this session with us, and we will have you back with many more sessions in future. And till then, the mothers are already connected with you in the feed section. So, mommies, if you have any queries, sir is available to answer it. So just put it in the feed section, and he reverts within 24 hours. So, and to all the users, we have a COVID special session coming up on Sunday, a webinar with all the guidelines with Dr. Ajay and his son, who's also a doctor. So, we will keep you updated regarding this, and we will see you in the next episode of Ask Me Anything session on Saturday. Thank you and have a great evening.
Thank you. Thank you very much.